Today, we spoke with Dr. Jim Shames with Jackson County Public Health about the county pivoting to handle the increase in cases in Jackson County.
So we are in the process of doing some triage, and we actually just got guidance an hour ago from the state to help us and other counties to manage the workload in a more efficient way. So that means we're going to continue to focus aggressively on the highest risk individuals in our population, those living in nursing homes, those who are already at high risk, those who work with those in those categories. And it may mean that other individuals might get contacted later, right? So the first contacts we're going to do are going to try and be to identify those folks at highest risk, and we'll kind of work down the list in a triage-like fashion and perhaps answer fewer questions that are on the questionnaire, maybe not make so many phone calls so that we can, just keep going and reaching out to people as best we can.
So is that as a way to warn them they might be infected and get tested and quarantined, or why would you reduce the number of questions, and how does that facilitate keeping the rest of the community safer?
Yeah, so the state rather has a number of questions that we ask of everybody. It's just part of the data collection that they do. It's helpful in a 20,000 foot view area. In terms of getting people notified that they've got COVID and figure out who their contacts were, those questions just take extra time. They're useful. We don't have the luxury of that right now. So we're going to have to try and reduce the amount of time on the phone with any particular individual so we can move on to the next person. And the state is helping us out by giving us some guidance of what questions they feel we could drop off for the time being.
Be sure to stay with us. And coming up tonight on Newswatch 12 at 5 and 6, we'll continue that conversation with Dr. Jim Shames.